Hi everyone. Today in this video we are going to discuss how we can use the drug prefixes in order to remember the drug names easily. If we observe the drug names, they will have suffix as well as prefix, and suffix can be used many of the times in order to identify the particular category of the drugs, otherwise to remember them easily. But sometimes you can also use the prefix of the drugs in order to remember the drug names as well as their categories. So prefix of a drug may indicate a clinical category. For example, a prefix like gly indicates it is a oral hypoglycemic agent. Prefix like MER indicates it's a mercury compound. And prefix can also indicate the receptor selectivity. Sometimes by using the prefix we can easily say that the drug is going to acting on which type of receptor. So all this can be obtained from the prefix. Even the suffix plays an important role in the identifying the drug names, but prefix can also play its own role. So today in this video we are going to discuss the different types of prefixes, what is the information they are going to give in order to remember the drug names very easily. Here we are not discussing the prefixes in alphabetical order, but we are going to discuss based on the significance of the drugs having the different types of prefixes. So let us start one by one. So first one is the prefix MIT. So here we have two drugs which are having the prefix MIT, mitoxantrone, and second one is the mitomycin. So here what is the prefix MIT indicates? Here MIT indicates they are the anti-cancer agents. Mitoxantrone is the one of an anthracene derivative which is belonging to the anthracycline antibiotics, and this drug acts by multiple mechanisms. It can act as an alkylating agent, it can produce the alkylation of the DNA which produces the cross-linkage between the DNA strands, and it can also act by DNA strand breakage by production of the free radicals which will damage the DNA strands. And this drug also inhibits the topoisomerase 2 enzyme which is very important for the DNA replication. In this way, mitoxantrone acts by multiple mechanisms and it can be used as an anti-cancer agent. Similarly, another drug is the mitomycin. Mitomycin is a bifunctional alkylating agent. Again, it produces alkylation of the DNA resulting in the cross-linkage within the DNA strands. And it can also produce the DNA damage by generation of the free radicals. So, these are the two drugs which are having the prefix MIT, which indicates that they are the anti-cancer agents. Second one is the NIFR. So, here we have one of the drug, nifurtimox, which is having the prefix NIFR. So what is this NIFR indicates? NIFR indicates they are the 5-nitrofuran derivatives. So this is the structure of the nifurtimox, and here you can observe a 5-nitrofuran group is present. So nifurtimox is a 5-nitrofuran derivative, and this drug is going to inhibit the trypanosoma cruzi which produce the American sleeping sickness. So nifurtimox is used in the treatment of Chagas disease caused by the trypanosomiasis. Third one is the NAB. Again we have one of the drug, nabilone. So here what is the NAB indicates? Here NAB is not indicating any chemical category, but it is going to indicate the receptor selectivity. The drugs with the prefix NAB will act on the cannabinoid receptors. Within the cannabinoid you can observe the NAB. So this is used as a prefix in the drugs which are acting on the cannabinoid receptors. Particularly these drugs are going to act as agonist on the cannabinoid receptors. So nabilone is one of the drug which is acting like a cannabinoid receptor agonist, thereby increases the cannabinoid activity. And nabilone is a synthetic analog of the tetrahydrocannabinol. Tetrahydrocannabinol is one of a natural product which is present in the cannabis species, which is a psychoactive agent. But here the nabilone, which is a synthetic analog of the tetrahydrocannabinol, is not used to produce the psychoactive properties. It can be used to decrease the nausea and vomiting. So nabilone can be used as an antiemetic in chemotherapy where the chemotherapeutic drugs can produce the nausea and vomiting. So whenever other drugs are not sufficient to control the nausea and vomiting, nabilone can be used because it's a synthetic tetrahydrocannabinol derivative. So here the prefix NAB indicates a cannabinoid receptor agonist. Fourth one is the gly. So drugs with the prefix gly includes the glipizide, glibenclamide, and glimepiride. So obviously here the prefix GLY indicates these drugs are oral hypoglycemic agents. So these drugs are going to be used to decrease the raised blood glucose levels. And here glibenclamide can also be known as glyburide, where it is having a prefix GLY. And these drugs are the second generation sulfonylureas. First generation is the tolbutamide, but second generation are starting with the prefix GLY. So these second generation sulfonylureas are going to inhibit the ATP sensitive potassium channels on the beta cells of the pancreas. When these potassium channels are blocked, the calcium can enter into the beta cells, resulting in the depolarization, and this depolarization of the beta cells can release the insulin. So the drugs having the prefix GLY are the second generation sulfonylureas, which can release the insulin from the beta cells. Next one is the trop. So we have one of the drug, tropicamide. Here the prefix trop indicates they are the atropine derivatives. They are going to be derived from the atropine. Atropine is a natural product, but tropicamide is a synthetic analog. And this is the structure of the tropicamide. Atropine is an ester which is formed by the tropic acid and troponol. But here tropicamide is not an ester. You can observe here there is an amide linkage. So that's why the suffix we can observe amide. Tropicamide is an amide that is derived from the atropines, so that's why it is having the prefix trop. And tropicamide can be used as just like the atropine. It is acting like an anticholinergic, so it can produce a pupillary dilatation. That's why tropicamide can be used as a mydriatic, pupillary dilator. Similarly, this drug can also fix the vision, so it is a cycloplesic, as this drug is going to produce a perils of accommodation. So vision is going to be fixed to a particular distance. So tropicamide can be used as an eye drops, as a mydriatic, as well as cycloplesic. Sixth one is the NAL. So we have few other drugs like the naloxone, naltrexone, nalorphine, nalbuphine. All these drugs are having the prefix NAL. And what about this prefix? So here NAL indicate these drugs are going to acting on the opioid receptors. But these drugs may be either agonist or antagonist. For example, here naloxone and naltrexone are the full antagonists. They act as antagonists at all types of opioid receptors, whereas nalorphine and nalbuphine are the mixed agonist antagonists. That means these drugs are going to act as antagonists at the mu receptors but agonists at the kappa receptors. In this way, here the prefix NAL indicates these drugs are going to acting on the opioid receptors, but these drugs may be either agonists or antagonists. And here naloxone and naltrexone, which are the full antagonists, are particularly used for the opioid intoxication. When the opioids are given at a high dose, these drugs can reverse the effects of the opioids because they are acting like antagonists. On the other hand, nalorphine and nalbuphine are the mixed agonist antagonists. They can be used as analgesics with less addiction and respiratory depression. Seventh one is the prefix SOM. Here we have two drugs, somatotropin and somatostatin. So here the SOM indicates these drugs are going to acting on the growth hormone receptors. Again, here they may be either agonist or antagonist. For example, here somatotropin is going to increase the growth hormone action by acting on the growth hormone receptors, whereas somatostatin is going to inhibit the growth hormone action by acting on the growth hormone receptors. So somatotropin increase the growth hormone action, thereby it can be used in the few of the condition like the dwarfism. Dwarfism is a condition of reduced growth because of the lack of growth hormone. Similarly, in the wasting disease, which is particularly observed in the AIDS patients, the somatotropin can be used. And somatostatin can be used in the treatment of acromegaly. Acromegaly is because of the excessive release of the growth hormone, where the somatostatin can be used. And the somatostatin can also be used in the treatment of VIPomas, the vasoactive intestinal peptidomas. In this way, these two drugs having the same prefix SOM, which indicates they are acting on the growth hormone receptors, but somatotropin acts as an agonist and somatostatin acts as an antagonist. Eighth one is the sulfa. We have a lot of drugs like sulfamethoxazole, sulfadoxine, sulfa-isoxazole, and sulfadiazine, sulfaselazine. Here sulfa-isoxazole is not having the letter A, but most of the sulfonamides are having the sulfa as the prefix. So here sulfa indicates they are the sulfonamides. And among these sulfonamides, the sulfadiazine can be used topically for treatment of burns and wounds. and sulfasalazine is a prodrug which is used in the chronic inflammatory bowel disorders. How these sulfonamides are going to act? Within the bacteria, PABA, the para-aminobenzoic acid, is going to be converted into dihydrofolic acid by two-step process which is carried by the dihydroterate synthase enzyme. So this enzyme is going to be blocked by sulfonamides. So sulfonamides are going to inhibit the conversion of the PABA into dihydrofolic acid. Next one is the Rifa. So we have drugs like the Rifamycin. The Rifamycin is also known as Rifamycin. And another drug is a Rifabutine. And third is the Rifapentine. All these are having the suffix Rifa. So here Rifa indicates they are the Rifamycins. Rifamycins are the class of drugs which can have an antimycobacterial activity. So these drugs, Rifamycin, Rifabutine, Rifapentine, act by inhibition of the DNA-dependent RNA polymerase within the mycobacteria. So they can be used in the mycobacterial infections. That's why these drugs can be used in the treatment of tuberculosis, leprosy, as well as the Mycobacterium avium cellulare complex, which is an opportunistic infection observed in the immunocompromised patients. And Rifabutine can also be used as a prophylactic in the treatment of meningitis. Next one is the Vin. So we have drugs like Vincristine, Vinblastine, Vinorelbine, Vindicine. So here the prefix Vin indicates they are derived from the Vinca alkaloids. The first two drugs are the natural products. Vincristine and Vinblastine are the natural products, and Vinorelbine and Vindicine are the semi-synthetic products. How these drugs are going to act? These drugs are going to inhibit the polymerization of the beta tubules. So beta tubules are not converted into microtubules. Since they are going to inhibit the microtubule formation, these drugs act as spindle poisons and they inhibit the mitotic division. Particularly, these drugs can be used in the treatment of lymphomas like Hodgkin's and non-Hodgkin's lymphoma and lymphoblastic leukemia. In all these conditions, Vinca alkaloids can be used. Similarly, we can see if you have the prefixes like the pred. So here the pred indicates they are the glucocorticoids like prednisone and prednisolone. And another prefix is the sal. Sal indicates they are the salicylic acid derivatives. And phos indicates they are the phosphorus derivatives. One of the drug here is the phosphomycin. Similarly, prost indicates the prostaglandin analogs. But nowadays, most of the prostaglandin analogs will have a suffix like prost. Similarly, the prefix mer indicates they are the mercury derivatives. So one of the drug is the mersalil. Mersalil is one of a diuretic used to decrease the blood pressure. And the prefix IO indicates they are the iodine containing contrast media. One of the drug is the iopanoic acid. In this way, we can use few of the prefixes in order to indicate their chemical category. Now let us say another prefix GAB. So one of the drug having the prefix GAB is the gabapentin. So what is this prefix? The GAB indicates the drugs are GABA mimetics. But actually it was found that gabapentin is not acting on the GABA receptors. So it is not a GABA mimetic. And gabapentin can be used as an anticonvulsant. The anticonvulsant action of this gabapentin is attributed to its action on the alpha to delta site of the voltage gated calcium channels, thereby can inhibit the neuronal transmission. So gabapentin is an anti-epileptic, but its action is not attributed to the GABA. So here the prefix GAB is used to indicate that they are the GABA mimetics, and the name of the gabapentin was given because it was believed that the gabapentin acts on the GABA receptors, but nowadays it was identified that gabapentin is having no significant action on the GABA receptors, but its action is mainly attributed to the voltage gated calcium channels. So this is an exception for the prefix where it is not a GABA mimetic. Even the drug prefixes will not give more information, but still we can use the drug prefixes in order to indicate a clinical category. For example, gly indicates are the oral hypoglycemic agents. Sometimes you can use to identify the chemical category. For example, sulfa indicates sulfonamides, mer indicates mercurial compounds, sal indicates salicylic acid derivatives. And we can also use the prefix in order to indicate the receptor selectivity. NAB indicates it acting on the cannabinoid receptors. NAL indicates they are acting on the opioid receptors. And we can also use the drug prefixes in order to identify from which natural source it is going to be obtained. So trop indicates it's coming from the atropine. Vin indicates they are derived from the Vinca alkaloids. In this way, Drug prefixes can give some information such that we can remember the drugs very easily. So that's for today. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.